You're ignoring your voice. And I would like to just engage the group here as far as, is there a lack of trust? And if so, how can we instill more trust into this effort? And it's obviously a sensitive issue, so I'd be curious to hear your thoughts.
Well, I would first say that we have different interests to start with. But then listening to comments and questions here, I would say that we've missed the importance of patient organizations. As IDF, we have 240 member associations around the world, which means that almost every country has its national association. And it is a spread hand from the GP or diabetologist to the patient. And of course, after having 3-day education, you cannot go home and know everything about diabetes. But then there are patient organizations that are here to help. And this is what we are really trying to encourage people to come. They will get education, they will have projects that they can get involved with, and they will be around people who have the same problems, the same issues. And yeah, many times researchers or industry has different interests than patients do. And sometimes they do come to the same goal, and sometimes they don't. We really do want to encourage both industry and research to work with the patient organization, if that's the easier part. And they can introduce research to the patient organization as a better organized and more professional, perhaps, than going to individual patients. So I think this
Johan,
is the way to do.
Johan, do you want to make some comments?
Well, I kind of agree with Kris, and you had the same experience. Trust is only an issue if you're asked to participate. It's like kind of like the second question. And first, we have to overcome the first hurdle, that we are informed properly, or there's a place where we can find the information, where we can enroll for clinical trials. And as I think Kris rightly pointed out, it's not so much a matter of trust. Of course, there is research which can be quite tricky, and I think that the organizations like you represent, but also JDRF, can definitely play a role in confirming the research and give us as patients more trust to participate.
Yeah, perhaps we will come to the question that we got through the web. And the question is, I would say, quite concrete. What would be your advice to researchers, whether in academia or in industry, to better design, run clinical trials to maximize the patient experience? So it's all about what we discussed, but concretely, how do you see things moving forward? What can we do to indeed increase your influence in the way clinical trials are designed and conducted?
I think recruiting participants at the earliest possible stage is key, and even when the projects are being planned, include the people that are going to be then tested on, almost, in that planning process. Get them in a room and talk about how things are going to be done. Obviously, things need to be done in a certain way, but I think that patient's opinion could help make the research more enjoyable for everyone, and make it more efficient, maybe more cost-effective. It's little things like saying, make sure the appointments are on the evenings or weekends, so I can actually come after work instead of having to take days holidays. That's a big problem for a lot of people. Really simple fix, which could have been quite easily communicated by a patient in one of those meetings. So I think, yeah, it's just keeping the patient engaged. I think not only will the patient offer insight and opinions, they'll feel valued as well by being asked that question. So from the start, they'll feel like they're not a patient, they're a participant. They're taking part in this research. They're just as important as the researchers, as the charities that are funding it, the nurses that are taking blood. They're all just as important. So, and at the moment, I don't believe patients feel that way. I think they feel more of a number than a person.
So early involvement might be the key. Yes, I think there is a question there, and then we will come to you. Yes, please identify yourself first.
Sure. Good morning, everybody. My name is Robert Johnston. I'm a board member of a group called the European Patients Forum, and I'd like to congratulate IMI and JDRF for this initiative, because I think what you're doing here in talking about research and diabetes actually reflects across the whole population of the community, and really reflects on a divide between science and the main bulk of the population. We've heard some excellent presentations from everybody this morning, and particularly Sandra, I liked what you said about empowerment and patient involvement. And I think we should capture this, and we should circulate it to the other patient communities where they haven't perhaps got the resources or the opportunities to do this. Certainly, as somebody who's lived with a chronic condition for nearly 60 years, not diabetes, but rheumatoid arthritis, I can identify with all the comments that the people have been making. My own sister lived for approximately 50 years with diabetes. She's now deceased. So I've had the personal experience of observing somebody with diabetes. And as I went through a process and a transformation and evolution into a self-managing patient, a person with a chronic condition, it's been very interesting to hear the sort of experiences people are having. And I see a lot of hope, actually, in the way young people with diabetes are self-managing their condition because they have to, because it's life-threatening, but also beginning to interact more and more with the scientific community into a partnership opportunity, which, as I say, I think should be reflected in all conditions, and not only for those of us with chronic conditions, but actually the way society should function in the future, so that we are, engaged more proactively in managing our own lives, observing what happens when we do things that are bad for us, observing things that happen when we do things that are good for us, and learning as a society. The final thing I'd like to say is that there's a very good group based in the UK called Involve. And the whole focus of Involve was to help the scientific research process, where it was funded by the NHS, to get patients, users, into that process. They've been doing that for many years, and if you need to go and have a look at their website, Involve, I-N-V-O-L-V-E, they have come up with many tactics, many kits, many ideas to help both researchers and users get involved in this process and do it effectively. And I would really encourage private enterprise to look to those examples from the NHS and to replicate them and go beyond them in terms of where the massive amounts of research are done. Thank you very much.
Thank you for this comment.
I think he makes a really good point there, the fact that type 1 is one of many conditions where you manage it yourself. You are the doctor for yourself. And in fact, at JDRF, we say 98% of clinical care is taken by the patient rather than a doctor. So doesn't that qualify us to have an opinion on how we cure our condition? And aren't we just as important as the researchers in their opinions in that respect?
Thank you.
Okay, I'm Hans Constant, CEO and founder of Ontavos, a Belgian startup. We want to create a platform to aggregate big data and bridge the data gap with a very strong patient-centric focus. Because I've got a medical background, ICT background, but moreover, I have 2 very sick people in my intimate circles. So I'm not a patient, but very closely related to patients. And my question to the 4 of you, because I really like the platform here and having the voice of the patient, really listening to them, right? My question is, I know initiatives like Genetic Alliance, Patients Like Me, and all these things, but the 4 of you, what systems do work for you right now, or what do you like? It's the first question, to know what is the research that's of interest to me? What are the clinical trials for me as a patient? And secondly, what would be the ultimate system for you if you can dream like for 1 minute? What would help us significantly to get to the research and to get actively participating in the right clinical trials?
Well, just go fishing where the fish are. So we are on Facebook, we are on LinkedIn. So rather than creating all kind of subsystems far away with very difficult URLs, come to us where we already participate, where we already are. And that would be extremely helpful for us.
I think there is one question there first.
Yes, Hildrun Sunset again, European Institute of Women's Health. I have a question to the panel here. When you took part in a clinical trial, how many women were on your on your trial? This is a battle. I must say we are fighting, first of all, from a regulator's perspective, but also from simply women being too busy doing all kinds of things that they are not really forthcoming as much as males to enroll in clinical trials. So has your experience, have you had a good balance in your clinical trials? What's the real life experience? Please tell me.
I think the simple answer is I don't know, and I think that highlights another important point, that I don't know the other people on the projects that I've been involved in, only through passing by them in the corridor or the opportunity where we've had the same appointments. But I would love to meet the other people that are on this trial. I'd love to speak to them about their experiences and even their condition, and even just having a chat with someone while you sat there for 4 hours being prodded and poked. So yeah, the answer to your question is I'm not sure. I mean, I'd love to know who else has been part of the trial and their experiences as well. And I think that's a really important part of opening up a community of patients that have taken part in research, because they can then go out to the wider population and promote research as something that's it's beneficial to the individual and the greater good, I suppose.
Olivier Arnaud from GDRF. I have a simple question to the patients who are participating to clinical trial. In a clinical trial, there is 3 main actors. There is a patient, there is a product, and there is a clinician. So you have obviously a relationship with a clinician, which explains the protocol and all that. What are your relationship with the product of the company itself, who can explain or not? What is your experience there?
My experience with the clinicians have been fairly good. I've always been very interested in research, so I've always asked a lot of questions, and I think they've liked that to a certain degree. They've liked someone who's been probably a little bit annoyed, actually, the amount of questions I do ask. They do get probably a bit fed up with me. But yeah, good relationship with the clinicians. However, the product part of the mix, I know of the scientific basics of the drug, but in terms of who produces it, any kind of private involvement in that, whether it's a pharma or whatever, I have no idea. That's something that's not really communicated very much. Maybe in the small print of the documentation when you sign your life away, but it's not something that's openly communicated about. So yeah, I'm not really sure.
One more question there.
Hi, I'm Iliam Gejaneto from France. I have questions about the information about the new device, of the new drugs. It depends of the knowledge of the physicians and how we can change that. Because, for example, the example of Mr. Nielsen, when I never been able, I'm type 1 diabetes, I never been able to note my glycemia. And fortunately, I can download that on my computers, because I always been to see my physician with no results at all. So, well, that's a real question, because there's lots of new results now for diabetes in general, and how all people could know that. And the second question is about a remark that put Kris about the result, good or bad. For example, I'm following results about closed loop. There's some nice results. There's less hypoglycemia, but there's some bad results too. The mean blood glucose in some of the tests, it's bad. The open loop do better results. So I know it's a question about the people who pay for the result. They want to have results, but it's easy to develop something on a paper and to do a test and have the result you expect for. It's completely different. Thank you.
Thank you for this question. Any
To comment on the second question you said there, I think the good and bad results is such an important thing to highlight. Bad results sometimes lead on to good results, and a lot of discoveries are being made outside in the general medical arena. A lot of things are being produced through bad results, and if we don't talk about the bad results will probably be repeated. And also need to highlight that research doesn't work every time. Lots of projects fail before one succeeds, so you really need to kind of get that across to people who are fundraising for the charities that are paying for it, or to the governments that are then funding it, and make it a point that, yeah, 1 in 10 actually succeed, or whatever that figure is, how important it is to communicate good and bad. There's generally more bad results than good from what I hear.
Yeah, there are two answers to your first question, I guess. The first is that we as patients have to pull out this information. We are able, not all of us, but a big percentage of us is able to go on the internet, find what is available in the market, and then ask for it. And the other thing is that the general practitioners and even endocrinologists, is a difficult word for me to pronounce, they treat a lot of different diseases. So I think they have to specialize. It's impossible to be world champion in 10 sports at the same time. So I think that they have to have a big patient base so they can specialize and therefore be better advisors to your personal care.
I would just like to comment on the research and clinical trials. They are extremely important, but it is obvious that not all of us can be part of the trials. So we need to find out, and we need to say to the research what the rest of us need. I would say that looking into psychosocial aspect of living with diabetes is a question that hasn't been raised in the past. So this is something that should be taken into consideration when developing research, when developing a new medicine or medical device. Even if the medicine makes perfect blood sugar and levels are just perfect, but if you don't feel well and if you cannot live your ordinary life, it's not good for you. So the involvement of your family, that's another aspect that should be taken into consideration. So there are a lot of elements here that are very important. And I would say clinical trials are excellent, but we know that there is only a certain amount of people that can be a part of it. So let's look at other aspects as well. Thank you.
I think there is a final question waiting. Please short, because we are running late. Thank you.
Okay, well, thanks very much. Pim de Boer from the Netherlands. I'll be short. One thing is a follow-up on Involve. Involve is a very good example, but do not forget that EPF itself also has its own process and procedures, also in the IMI UPATI project. Well, the question I have is, you being patient representatives and listening to all things happening in clinical trials, as a researcher, we can think of many things that are very fascinating to measure. But do you think that your needs are really being addressed, that the right things are really being measured in the clinical trials up to now?
I would have never thought of an iPhone. So I think you should be ahead of us, and if you, there should be a vision, and we only know what we have, and maybe can think one step ahead, but it's impossible to answer your question, because sometimes there are solutions or maybe trials beyond what we can imagine in our day-to-day life. So, well, that will be my answer. I don't know, Henning.
But I think it's an excellent concluding remark to introduce our first session this afternoon. We will see at least how IMI currently and hopefully in the future is indeed addressing your needs more specifically. So let's have lunch now and we will reconvene at 1:45. Thank you.